Good morning, everyone. Good afternoon. As we're settling in, if you want to share where you're joining from in the chat, please let us know. Joining from all over the place. Gonna give it 2 more minutes and then we'll get going. Settle in, get something to drink, and get started soon.
Yeah, take a moment to introduce yourself in the chat, and we'll be getting started in just a moment.
Okay, wonderful. Hello, everyone. Thank you so much for joining. As people come in, no worries, get settled in, and please introduce yourself into the chat. We are so excited to welcome you to our third and final webinar for the Uplifting Contextual and Experiential Evidence Project. I'm going to pass it to Sophia to get us started.
So I'm going to go over the objectives for today. We are going to review findings from the Uplifting Contextual and Experiential Evidence Promising Practices and Recommendations report to integrate 3 forms of evidence into decision-making for funding, strategies, policies, programs, and long-term planning. On the agenda, we have welcome and introductions, present report strategies, present report recommendations, and have a discussion with you all. Here is the Prevention Institute team that's been working on the UC project. We have Sheila Savannah, Ruben Cantu, Vibhuti Cacholia, Sofia Bateo, and Grace Guerrero Ramirez. Finally, this is an acknowledgement of our cooperative agreement with CDC. We also want to thank them for their continued support throughout this. That, I'll pass it back to Vibhuti to give us some background.
Wonderful. So for those who didn't have a chance to join us in the last two webinars and maybe newer to this project, we wanted to provide a quick background and overview before we get into the report. So as we know, evidence-based policies, projects, and practices are quickly becoming the standard in proposals, funding opportunities, and more. And about 13 years ago, the CDC published Understanding Evidence Report, and that was to give guidance about evidence-based decision-making. Last year at Prevention Institute, in partnership with the CDC, we developed a series of health equity in practice modules, which are on our website. We'll see that in the chat in a second. And during this project, we saw how important evidence is in community safety and violence prevention work and its role in elevating health equity and racial justice. So this all laid the foundation for the Uplifting Contextual and Experiential Evidence project that seeks to understand how organizations are uplifting and integrating contextual and experiential evidence in their programs and practices. So in this project, we developed an internal landscape scan, conducted subject matter expert interviews, and shared those findings in our first webinar. We also hosted Dr. Catherine Bocanegra from University of Illinois, Chicago, and Fariha Waheed from Baltimore's Trauma-Informed Care Task Force in our second webinar, where they shared their experiences about weaving all three forms of evidences. We have finished the final report of this project and are excited to share our findings and recommendations with you and with the wider public health audience. So I'm going to pass it to Grace to get us started walking through our report.
Great. Thank you so much, Vibhuti. Hi, everyone. So on this slide, we show a roadmap of the report just to get us grounded on the context. So I'll just provide a very quick overview of what's included in the report just before we dive into some of this content into today's presentation. So first, we started the report by providing context on the role that evidence plays in public health and why we're having to have this conversation in the first place. And then we also discuss our approach to the landscape scan that Vibhuti mentioned previously. Then we get into more of the practical components of the project and highlight some strategies to uplifting contextual and experiential evidence. And we also provide a dedicated example for what it can look like to weave different types of evidence in public health. And finally, we close with some recommendations and call to action for public health sectors. So today's conversation will mainly focus on those key components and the recommendations and call to action. We should have a pretty cool conversation about that. So next slide, please. Okay, so diving into the report, as Vibhuti mentioned earlier, the why of this report and overall the project is really linked to the role of evidence in public health. And we have already talked about this in previous webinars in the series, so some of you who already participated in previous webinars might find this familiar. So this will be a refresher for you. But first, we are aware that public health is increasingly reliant on evidence to make decisions about where to allocate resources, what programs and policies to implement, and how. And the CDC developed a framework called Framework for Thinking About Evidence that describes three types of evidence that are critical in decision making. And I'm going to define them now. So the first type of evidence is best available research evidence. And this type of evidence often emphasizes or privileges studies that are deemed scientifically rigorous. So we may think about, for example, randomized controlled trials and systematic literature reviews and so on and so forth. And this type of evidence is commonly used to decide if a program, practice, or policy is working as intended. Next, we have contextual evidence, which refers to information that is collected from local and community sources, and it is used to understand how community contexts and characteristics could impact the implementation of a strategy or decision. And contextual evidence can be collected through things like needs or assets assessments, which are things that, for example, health departments do a lot of, census data, surveys, and local administrative data, such as data from hospital, schools, law enforcement agencies, and other types of institutions. And finally, we have experiential evidence, which is really a process of collecting knowledge and experiences of people who have practiced or lived in the community of focus or who have directly experienced the issue that we're looking at. And this type of evidence is typically gathered through focus groups, interviews, communities of practice, and other engagement strategies. So I hope that serves as a nice grounding in providing definitions about what we mean by these three types of evidence. What this report kind of lays out is that while there have been many efforts to validate the utility and value of contextual and experiential evidence, public health still pretty much relies on best available research evidence due to its credibility in what we call evidence-based decision-making. A lot of you might be already very familiar with that term. And while certainly best available research evidence really plays an important role in data-driven decision-making, we acknowledge that it comes with its limitations. For example, what we have traditionally defined as credible evidence may not always reflect the needs and desires of community members or what really works for them. Sometimes these types of evidence excludes communities altogether. And we recognize that decisions about what gets or doesn't get included in the traditional evidence space is still mainly dictated by structures that have and continue to perpetuate inequities. So with all these considerations at hand, our project and our report underscores the importance of increasing support for using contextual and experiential evidence to inform decisions about public health issues that are affecting our communities. Next slide, please.
Awesome. So the overarching goal that we are looking to achieve is balancing or moving towards weaving all three forms of evidence for a balanced approach to decisions about funding, strategies, policies, programs, and long-term investment and planning. So to do so, we must uplift contextual and experiential evidence, both in supporting communities in cultivating and generating it, and the field using that evidence for decision-making. So on the left, you'll see the framework of thinking about evidence from the CDC, and on the right, you'll see our own reimagined version of this framework focused on weaving them all together. So at the next slide, we'll talk about the four components that we've put together. So the landscape scan and the subject matter expert interviews we conducted in this project led us to conceptualize four components to uplift contextual and experiential evidence and how they are interrelated and support community leaders as they collect, integrate, and sustain these forms of evidences, and ultimately weave all three forms to inform decision-making. Practicing meaningful community engagement and elevating lived experience, shifting power, ownership, and action to community, and implementing community-driven methods and approaches work in tandem with investing for sustainability to strengthen the contextual and experiential evidence base through various strategies that we will describe in the following slides. So I'll pass it back to Grace.
Yeah, so I'll get us started with the first key component that we highlight in the report, and that is practicing meaningful community engagement and elevating lived experience. So uplifting different types of evidence, including contextual and experiential evidence, really requires that we meaningfully engage community members, including people with lived experience. And just so we are aligned on definitions, when we say people with lived experience, we mean people who are directly affected by health, social, and other issues. Not only the issues, but also the strategies that can potentially address those issues. Now, what we mean by meaningful engagement really depends on what individuals and communities feel is meaningful to them. And this will vary across communities. It will depend on existing relationships between institutions and communities, and so on. But for the purposes of this project, we recognize that meaningful engagement often requires us to involve community members in decision making. And please lean into that for a little bit, because I'm going to turn back to this in a couple of minutes and dig a little bit deeper in that regard. So with all that grounding, we are talking about community engagement as a key component because contextual and experiential evidence is at its core driven by community wisdom and participation. Being in relationship with community helps us understand community context, important nuances and experiences that we might not find in the research literature. And communities can also, again, provide like context to data, trends, and changes observed in your community, and provide expertise that may not only be based in their lived experiences, but also academic and professional experiences as well. So I want to note that our intention here is not to provide concrete guidance on how to specifically engage communities and talk about what that looks like and what the process is and what are the logistics to consider. That is beyond the scope of our report. There are actually many resources out there to help us in that regard, and we actually reference them in the report. But we do want to highlight two strategies that are really important to consider when we're planning to bring a group of people together to share their perspectives and expertise about a specific issue. The first strategy is ensuring that the engagement is diverse and is reflective of the specific community that we're working with. For example, decision makers or whoever is leading the effort should really carefully define who are the groups that we want to engage and why, and how we're going to hold ourselves accountable to that type of engagement. And here I want to note that sometimes it's really easy for us as researchers to tap into the same people to engage their expertise. This might be like allies and people that we already know. And, we know that we want to invite them to participate in this advisory group or research study. And that is okay. But it's also really important to move beyond engaging the people that we regularly engage to really expand the scope of opinions and experiences that are out there. The more diverse a group that we engage, the better, to ensure that the evidence that we're helping produce are being reflective of all the diverse and varied communities that we're working in. So I'll leave you with that. And then the second strategy that I want to emphasize here is forging strong community partnerships and relationships. This is really important to building trust and also understanding the diversity of experiences and identities and perspectives that exist within a community. Forging these partnerships can also help us identify appropriate outreach and engagement strategies to get at the community members that we really want to engage. Okay, so I know I shared a lot of content. I again want to emphasize the importance of relationship building and trust. But now I want to introduce the concept of power. And don't worry, I'm not going to get all philosophical about what power means and what are the complexities of power in public health. But I do want to put a spotlight on the power dynamics that are really inherent to this work. Because the efforts to support contextual and experiential evidence really signify a shift in how we think about knowledge and power and who holds the power and who wields it. So let's get to, second slide and our second component around shifting power, ownership, and action to community. When generating and using evidence for decision-making, institutions such as government agencies, philanthropy, universities have an opportunity to exercise their power and authority by shifting power and ownership to communities. And just because we are interacting with communities doesn't mean that we're necessarily shifting power and ownership to communities. Shifting power really requires an explicit commitment to kind of widening the group of people who are involved in shaping evidence, strategies, and decisions, especially people who are most impacted by the issues that we're looking at and by inequities. The more that we support communities in generating evidence for action and in using that evidence for decision making, the better we set communities up to have more direct control and ownership over the decisions that affect them and resources that they need to thrive. And with speaking specifically about contextual and experiential evidence, the question of who owns data is particularly important here, because traditionally, researchers have asserted their authority as gatekeepers and owners of data that reside in communities. For example, we are aware of situations where researchers come into a community, they take data with them, they analyze it, and community doesn't see that data. Again, no one knows what happens to that data except maybe the researchers themselves. So pushing for contextual and experiential evidence is at its core about community ownership of their data. Another thing that I wanted to mention here is that supporting communities to collect, manage, and share their data helps affirms communities' power and self-determination, and it also helps build local community capacity to sustain their efforts over a long period of time beyond the life cycle of grant funding. So to get a little bit more granular here, I'm going to highlight 3 strategies to shifting power and ownership in evidence and decision making. And the first is supporting training and capacity building. And we're not thinking about training and capacity building as a process that is like goes in one direction, where like communities are like the recipients of institutional knowledge and training. That's not really exactly what we're getting at here. We're looking at training and capacity building as a multi-directional process where institutions embrace existing assets and resources in a community and also support building communities' capacity to produce and use multiple forms of evidence. The second strategy I want to highlight here is developing coalitions and, again, building community power. So by building partnerships between community-based organizations, residents, and local government agencies, each partner will bring their own power and knowledge that can be leveraged for more large-scale, impactful change. And finally, the last strategy I want to highlight is assembling convening bodies to mobilize community expertise. And here we're talking about commissions, advisory boards, task forces, and work groups that really are opportunities to convene diverse community members to share their expertise on an issue or a project. And a lot of these different convening bodies have the potential for making decisions collaboratively. They look very differently across different settings and depending who is involved, but there's a lot of opportunity there to really be in relationship with community and uplifting different forms of expertise and making decisions. So all in all, this core component is about building power within communities. So specifically, how contextual and experiential evidence can build community power and ownership and vice versa. I've talked a lot already, so I'm going to let that sit. These strategies start to get at some of the tools and methods that we can use to produce and use local data in community. So I will turn it over to Vibhuti so she can share a little bit more about that.
Awesome. So the third The third component that we want to share about is implementing community-driven methods and approaches. So evidence-based decision-making requires the collection and use of measures related to health and well-being. And implementing and using increased variety of types and sources of data can be helpful in gathering contextual and experiential evidence to provide a richer view of what's actually happening in a community. So community data, which can be collected through community-driven approaches and methodologies, can describe community characteristics. These include things like poverty, gender or racial economic inequity, social norms, things like that, which go beyond individual level data points to illustrate overarching trends in the community. It can also illustrate community assets and challenges and how specific historical contexts, trends, and cultural assets within a community might impact how a program, intervention, policy, program are implemented in one community as opposed to another community, and how they differ within community. So key strategies in implementing this component is utilizing rigorous methodology and tools, which includes using community-driven research methods like community-based participatory research and other established frameworks to collect data of interest and to be able to present it back to the community. We have a few different sorts of frameworks that we share in the report as well to see sort of what sort of frameworks and things you can use to encourage this sort of rigorous methodology. Assessing local communities and geographical areas also instead of using exclusively national or global data can correctly understand the context and the characteristics of the community that you're working with. And then lastly, bridging numbers and narratives and employing narrative data, which couples qualitative information consisting of stories, quotes, and impressions that are gathered from stakeholders and residents, alongside the quantitative data and statistics that you may already have to paint a really comprehensive picture of what's going on in the community. So while collecting these different types of evidences alongside power sharing and community engagement, like Grace shared, it's all fundamental to uplift contextual and experiential evidence. We know that all of this work thrives when there is sustained and long-term funding. So the last component we want to talk about is long-term investing for sustainability. I'll be on the next slide. Commitment to long-term investment for sustaining the collection and integration of contextual and experiential evidence is imperative for weaving multiple forms of evidences. In the report, we describe long-term investing both as monetary investment and non-monetary investment. Monetary investment includes flexible funding that isn't tied to an outcome and can provide grantees the opportunity to support and respond to community-identified priorities and research, as well as technical assistance or capacity building. It can also include operational funding and grants, better known as core support, to ensure that organizations have the support to create sound administration and infrastructure to collect data and sustain practices of engagement and measurement. And non-monetary investments can include connections to other organizations, personnel, support for data collection and evaluation, and resource sharing. These types of investments can be leveraged to further network development, peer learning, and collaboration based on shared missions and goals, which establish a strong structure for sustainability. You can go to the next slide.
Great, thank you, Vibhuti. So on to examples. We understand that some of these concepts might feel a little bit abstract when you're just reading a narrative. So I just wanted to note that for each component, we do provide short examples to help illustrate what we mean by investing for sustainability or meaningful and diverse engagement. So just wanted to put that out there. But I do want to note that we showcase one project. It is a California-based project that we feel really exemplifies many of the concepts that we have presented, specifically in how to harness community expertise to generate locally relevant data for day-to-day decision-making. I'm talking about the Imperial County Community Air Monitoring Project, which brought together community residents to plan for and implement an air monitoring network that will let residents know how healthy it was to breathe the air in their communities. This is a county, Imperial County, that has seen a lot of inequities and exposure in air pollution. So this is just a really great example to illustrate the use of contextual and experiential evidence and other types of evidence to make decisions that better serve their communities. We include more details about this project in the report using publicly available information in the web, but we just wanted to highlight that that is part of the report. And with that, I think we're gonna pass it over to questions.
Yeah, so I know we've shared a lot with you and you might be processing all of it, but we wanted to take some time and some space to see if anything was coming up for folks as we share some things, or there's any questions or clarifications that we can provide. So if you would like to unmute, this is the time to do so, or put it in the chat as well, but we'll give a few minutes just to see if anything is coming up for folks.
If I could, I would like to share something. And yeah, I read the report, but and it is related. I wanted to talk a little bit more about power, because I think it's a very, very, very important concept. And you know, I think in the community, when the word power comes up, I think there's always a tendency for people to cringe a little bit, because it's so often misused. So power almost like automatically gets a negative connotation, especially in communities of color, in community, because of its abuse so often. So it's a very loaded word. I'm sure like in Spanish, power trans, and I'm sure in other languages it's something similar. In Spanish, it's poder, and poder, as it's in the language, really means the capacity, the ability to bring to realize something, to make something happen. Nothing negative about that, you know, not really, but even in you know, in countries like that, I mean, in other countries, the word power always has that negative connotation. And what I wanted to do is just, if I could just share a little story about how, you know, where I learned a lot about power. You know, about 15 years ago, I had the blessing of meeting a Native American from Mexico, from the state of Jalisco, Guadalajara. And over the course of 13 years, 14 years, I'd go visit him and he'd come visit me. When I went to go visit him, as soon as I got there, everybody automatically got my bag. They took my bag, they took my backpack, they took everything, and they would lead, and I would follow. And then when Don Marcelino would come here, and he was a very, very well respected man in his community. He was probably spiritually and in civic engagement at the top of his community. And so when he would come to visit me, we would go places, and I would try to walk beside him, right? Because, you know, that's how we do things. But he would walk behind me. And it was very, very uncomfortable. We'd be walking down the street, and here's this old man walking behind me. And as much as I tried to bring him up next to me, and when things got kind of, there were situations where things might have been tense or uncomfortable, he would get closer. I mean, he was just like right behind me. So I asked him one time about that, and he said, "Bueno, mi hermano, you know, my brother, this is your world. And you walk up front because you know your world, and I'm gonna watch and I'm gonna observe." And so, you know, I reflected, I thought about it a lot, that, and so then when I would visit down there, I would just have that more in mind, that this is their world, and I'm going to walk behind, and I'm going to observe, and I'm going to be quiet. And you know, when we're trying to, and I take that into my work, you know, when I go into communities, I really have to work hard at not assuming that I'm an authority. It takes hard work to really, I think, to really follow and really from that perspective, it's hard work. It's a challenge. I think the work that we're doing is a huge challenge because we're so accustomed to, I think, just almost unconsciously to assume that we are authorities wherever we go, which is, you know, it's not true. It's not true. I wanted to share that because I you know, those kinds of things, that's hard to say in a report. It's just hard to say in a report in a way that I think reaches and touches people. But I you know, it's what came up as we were talking about power specifically.
Thank you. Thank you so much for sharing that. Doctor, would you mind introducing yourself also for
Oh, I'm
folks?
sorry. I'm sorry. Yeah, Heriberto Escamilla from the National Compadres Network in California. Yeah, sorry about that.
Thank you. And just FYI for folks, uh, Dr. Beto was one of the folks who we interviewed and had a conversation with toward the beginning of this project. So he's gotten an advanced look at the report yet before it comes out. And we'll talk a little bit later about when the full report is going to be coming out for other folks to take a look at. So thank you for sharing that, and I think that story really kind of illuminates what we mean by power and letting community lead when they know the needs and the strengths and the assets of their community. Any other questions from folks?
Zachary, go ahead.
Yeah, I had a question about sometimes it feels like there's this no man's land between not coming in and coming in with a preordained game plan of how to do it and then following the community's lead. But then sometimes there's that the community will be like, but okay, what are we trying to do here? And so like, is there examples in the report of kind of like that middle ground of like, maybe we're bringing in structure, but they're bringing in the perspective and I'm real hesitant even like saying I'm bringing in structure because I think part of the work is really like, I'm not coming in with my preconceived notions about what the evaluation should look like and more so kind of having an inductive process with community.
I can get started. Or Grace, do you want to
No, go
respond?
ahead, Vibhuti.
Yeah, I think the report has a few examples of sort of institutions coming and meeting communities at a good place. You know, I think there are so many pressures and so many deadlines and all these things that institutions face when they are doing work in community, and there are the needs and challenges and things that communities want to sort of address as well when this work is happening. And there are different ways in which there are structures and there are avenues in which institutions can meet communities sort of halfway in a place. You know, I think it's a spectrum of consultation to working with folks to letting them lead, right? And we're all sort of on this path of getting to a place where we're working with the folks who we're serving. So I think there are a few examples there, but I'll pass it to Grace to see if she has anything to add.
Yeah, I don't think we get like as granular into explaining, oh, what does it look like to hold like a facilitation meeting with community members, or what does exactly look like to provide like that structure. But it can look differently. Like there's so many different possibilities. Like researchers can potentially kind of tied to the question around training and capacity building. But for example, enter into a process where they help community members understand how to do community-based participatory research or action research. What does it look like for community members themselves to collect data through surveys or interviews or focus groups? And then, the researcher is there to provide that support, but community members kind of like lead the work and carry on. And in that way, you kind of like build that capacity for community members themselves to do the work. And then if communities say like, hey, health department or academic partner, we need your help analyzing this data, or we need your help providing some like statistical data that we can put in front of like our policymakers, then that's how like different institutions can like wield their power to support communities' capacity. And I think if you look into the example of the Imperial County project, they do provide like a whole guidebook on how they engage with communities and how they facilitated conversations with community members over how the projects should be implemented. So I encourage you to look into those resources as well.
Thank you.
And I think at the foundational level, I think it's about entering into initiatives as much as possible in partnership with communities so that they can be part of the discussion from the beginning and not kind of be brought in midway through. I mean, sometimes it's unavoidable, right? Like sometimes maybe we're learning about this now as something as we've already like started a project, right? So sometimes it's unavoidable, but I would go into it a little bit more in the report about like how can we actually start these projects from scratch with community involved as part of the discussion at the table so that we can have kind of the strongest relationship and an opportunity as possible for the outcomes we want to see. Any other questions before we move into the next part, which is talking about the recommendations? Great. So then I think we can move forward. So I mean, we've gone through what we've learned, and while we've outlined a number of strategies that uplift contextual and experiential evidence so that we can weave in all three forms of evidence and decision making, we also need to acknowledge that the different roles that folks play in the public health field can have an impact, right? And these different roles are the result of are working from a place of different levels of like power and organizational privilege, institutional position, access to existing funding and data and resources. And that's something that we need to acknowledge before going through and talking about some of the recommendations that we have and how easy it is, because people are coming from different places. So we fleshed out recommendations in the report to share high level and role specific guidance for 5 different and important sectors in the field. So we take a look at federal agencies, local and state health institutions, philanthropy, academic researchers, and I feel most importantly, community-based organizations. So Vibhuti and I are going to go through each of these actors in the public health field and our recommendations for each of those groups of folks. So next slide. So our recommendations begin with federal health agencies. While this project, as we've shared, was initially providing guidance for the CDC and was supported by the CDC, these recommendations, as we've kind of been developing them, we've kind of come to realize that these recommendations are applicable to all federal health agencies as institutions like HRSA and SAMHSA, CDC, and others. They fund the majority of our local public health initiatives, and they're very influential in what kinds of programs are funded and what and how what and how funding is received by communities. So there are 5 recommendations for federal health agencies that we share in the report. The first one is that we encourage these agencies to include opportunities for folks seeking funding to share multiple forms of evidence, including contextual and experiential evidence, in their proposals, grant reports, and evaluation plans. Just kind of to counter that over reliance we have on best available research evidence. We also encourage them to establish and maintain long-term partnerships that build trust with community organizations and residents to strategically collect and utilize all 3 forms of evidence. And so this is even thinking beyond like the funding relationships that we might want these federal health agencies to have with community organizations. A lot of times federal agencies provide funding to a local health department or a city or county or state health department and not directly to those CBOs. So we really encourage these federal agencies to, even if it's not a funding relationship, to develop kinds of really strong relationships and partnerships with CBOs so that they can support and be more involved in how folks are collecting and utilizing different forms of evidence. We also call on these agencies to ensure funding opportunities are accessible to those community organizations that a lot of times don't get funding and don't have access to that kind of support. And that can be through providing flexible timelines and ample funding so that those CBOs can also meaningfully engage their community members in their work. They should also create opportunities to share power with community residents and organizations to be part of decision-making bodies. We talked a little bit about the importance of power and what that actually means, and coming into the work knowing that community members are the experts in their communities. So create opportunities to make sure that those folks can engage with CBOs and can engage with people with lived experience. And then finally, conducting internal reviews of the types of evidence that are collected by the agency to assess, the kinds of evidence that they currently use in their decision making, in their funding, in their policy making, and also to ensure that multiple forms of evidence are supported and upheld by the agency in the work that they're doing. I'll pass it to Vibhuti for the next set of recommendations.
So similarly to federal health agencies, local and state institutions also play a very important role in funding many public health initiatives and really set the tone and priorities for states and localities that they serve. They also have the opportunity, because of their proximity, to build deep relationships and partnerships with community organizations that they work with. And we want to note that for grant-making organizations like the one before this and then the one after this as well, a lot of the recommendations that we have focus on funding strategies and inclusivity. And that's why they all are a bit similar, but they all play an important role in this specific aspect of this work. So the recommendations that we have for these institutions are to, again, encourage presenting multiple forms of evidences, including contextual and experiential, in developing and responding to funding opportunities and grant reporting and evaluation, as well as establishing these long-term relationships and building trust with community-based organizations and residents to collect and utilize all forms of evidence, to ensure funding opportunities are accessible to community-based organizations, similar to what we talked about in the last slide, and to provide flexible timelines and ample budgets to meaningfully engage community members, to create opportunities to share power, of course, and to conduct another internal review of the sorts of evidences that they are collecting internally, and to see what sorts of other forms of evidence that they can support and uphold, especially as, health agencies and local health departments collect a lot of really useful data, but sometimes because of the siloing of these institutions, because they can be pretty big, you might not know what's going on throughout the entire institution. So that will be a really important part to really understanding and uplifting all forms of evidence. Go to the next slide. Back to Ruben.
Thanks, Vibhuti. So again, continuing with this theme of entities and actors that have an influential role, especially when it comes to funding. The next one is philanthropy. And philanthropy, as we all know, plays a really special role, a critical role in the public health field, with a unique flexibility and openness to funding a variety of innovations and strategies. A lot of times, philanthropy is able to fund the things that the federal government or state and local health agencies are not able to do, and a lot of times have to end up like kind of filling the gaps when those other entities are not able to do the work. We saw that really clearly during the COVID-19 pandemic when our federal and state and local health agencies and entities had to really shift a lot of their focus to testing and vaccination, and it fell to philanthropy in a lot of cases to help sustain a lot of the other important work in the public health field. And philanthropy, especially local philanthropy, has a really big role to play in supporting those kind of smaller community-based organizations that might not have the resources, the capacity to be able to apply for and receive funding from some of those larger governmental entities, right? So when it comes to uplifting contextual and experiential evidence, philanthropy has the opportunity to support that really deeply rooted community work and to leverage their power in service of communities. Philanthropy also can be very influential when it comes to policy making and decision making as well. I mean, I'm located in California. Some of our biggest philanthropies in California, like the California Endowment and the California Wellness Foundation, are very influential in a lot of different ways. Just because of the size of their endowments and the size of the amount of money that they can provide, but also because they are able to kind of support a lot of the work that sometimes would not get supported. So a lot of the similar recommendations here, encouraging folks to be able to use multiple forms of evidence in developing and responding to grant opportunities and their reporting and their evaluation plans, to make sure that we're ensuring and creating funding opportunities that support inclusive community engagement and collection of community-driven data and evidence, and that we need to ensure that funding opportunities are accessible to those community-based organizations that are doing that deeply rooted community work, and have those flexible timelines and the budgets to be able to meaningfully engage community members. I'll pass it back over to Vibhuti for the next one.
We also wanted to touch on the key role that academic researchers play in generating evidence for public health. I think in the last few years, in the last decade, we've really seen a shift in a bridging between academia and the work that community organizations are doing. And this is really important because academic researchers really have authority over how and what type of research is supported, upheld, and deemed credible. And we want to provide recommendations on how they can continue this work and uplift contextual and experiential evidence alongside the generation of best available research evidence. So we have a few recommendations for them here. One is to establish and build trust with community organizations to weave best available research evidence with contextual and experiential evidence, similar to what we were talking about in that narrative data piece. Second is to employ methodologies that use contextual and experiential evidence, like community-based participatory research. Third is to employ, train, and co-design research projects with community researchers and folks from the community. Fourth is to meaningfully engage community residents and organizations to create and prioritize research agendas to really set the stage of what folks are learning more about and contributing to the literature. And 5 is to practice and support community ownership in data governance. And this is really going back to this power piece and what Grace shared earlier about sharing power and data to bring that ownership back to community. I'll pass it back to Ruben.
Thanks, Vibhuti. And so finally, we don't want to understate the power and the role that community-based organizations and community advocates and local residents have in uplifting contextual and experiential evidence. They're the folks that have the greatest proximity to community residents and members. So they're the ones who are really able to gather and organize opportunities for utilizing and uplifting community data and voice. So some of the recommendations here are to commit to sharing stories and narratives of the community members and residents engaged in programs, policymaking, practices, just in kind of all aspects of what's going on in the community. There's like a really great opportunity to marry the data that we have, what we're hearing from community members, and then using that to tell the story, to shift narratives and to shift the way we talk about things, so that that's kind of what will lead us to changing policy. I think, if you look at any big public health movement or big public health policy change that we've seen in our lifetimes, things like seatbelt use and smoking cessation and tobacco control. You look at all of those kinds of things, and all of those things kind of happened by having the scientific data, having the voices of community involved, and all those things together helped to make policy change happen, which ended up leading us to like norms change and systems change. And that's the way we kind of make true change happen in the community, by utilizing all of those things together. So like making sure that we're sharing, collecting those stories, those narratives is a really important part of shifting norms and shifting policies. Collecting administrative, quantitative, and qualitative data on priorities that are elevated by community members. And that's just like utilizing every kind of methodology, every kind of way and means that we have of collecting data is important. It can be having focus groups, having interviews, hearing what people say on the street. If you use promotoras or community health workers, they are hearing the stories that people share about their concerns and needs every single day. People that work frontline jobs, the people that work, the receptionist job at like the community clinic or the CBO, like they are hearing what people say every single day. They're the people who get the complaints from people every single day. Like utilizing all of that kind of information is really important. Going hand in hand with what Vibhuti just shared about academic researchers. So building those relationships with academic researchers and building that trust between academic researchers and community-based organizations and members. A lot of times, some of the smaller CBOs that we've worked with at Prevention Institute have never worked with an academic researcher. And a lot of times their experiences that they might have had with academic researchers have been negative. We see a lot of academic researchers who parachute into a community, extract information, then leave, and then you never hear from them again, or you never hear or see of the results of like what information they collected from you all from that focus group or that town hall meeting. And so developing the relationships with the kinds of academic researchers that are really committed to community members is a game changer. I'll throw out a plug for, we're partners with a group called the Black and Brown Gun Violence Prevention Collective. And it's a collective of mostly academic researchers who have on the ground lived experience in communities of color and are committed to doing their best to make sure that research into gun violence prevention is equitable and has a racial justice lens to it. And finding those people and developing those kinds of relationships with folks can really help to elevate the game here. And then finally, recognizing the organizations convening power and inviting institutional partners, whether it's the local health department or philanthropy or academic researchers, to the table so that they can get to know you, you can get to know them, and that we can kind of increase the size of that table and have more people involved in our conversations. So I think we can move on to the next slide. And so we're gonna ask you all a couple questions, but we also have plenty of time for discussion as well. So we're gonna be asking you all these three questions. We're gonna shift over in just a second to a Mentimeter polling function. So you'll be asked to take out your phone so you can point it at a QR code that's going to come up. But we're going to ask you about what types of recommendations that we've shared today have resonated with you the most, what successes that you've experienced in putting recommendations into action, and also what challenges you've experienced, and what additional resources would be helpful for you all to either implement these recommendations, share them with others that you think need to hear them, etc. So I think we can switch over to the first one of those. Great. So if you all could just take your phones out, point it at that QR code, and it'll take you to this question where you can pick, and it's a multiple choice. So what types of recommendations resonated for you? Was it the ones around making sure that there's flexible funding that can support different kinds of evidence? Is it around research, partnership, collecting different types of data, prioritizing engagement? And there's one behind the QR code that I can't see now. Grant opportunities. Yep. So yeah, so it's kind of cool. We can see in real time as people are kind of voting on these things, which type of recommendations resonate for you. And I think you can, we have it multiple choice, but you can also pick multiple responses. So looks like collecting different types of recommendations around collecting different types of data and prioritizing engagement, community engagement and data collection are getting a good number of votes here. We'll give it another 20, 30 seconds. Okay. Thank you. That's good to know. We also encourage folks, if you want to get off mute and you want to say something, please feel free to say something. But I think maybe we can move ahead to the second question. And this one, so again, point to the QR code here, and you're able to go to the page. And for this one, I believe we're going to give you all the opportunity to just type something out. So we'll give it a couple of seconds and see if we get any responses from folks here. Oh, thanks, Vibhuti, for the clarification. Okay. We're not seeing any responses coming through. I'm not sure if people Yeah, we'll share the recommendations in the chat here. I mean, we're getting, I don't know if everybody else is seeing it the way I'm seeing it. I'm just seeing blank space for responses.
I had to hover my mouse over and then highlight it because the background is white and the letter is white.
Oh, okay. Hmm. Yes, thanks, Grace. Oh, there we go. Okay. Flexible funding has been the most difficult. Usually program directives and outcomes are very rigid. Creating relationships and starting partnerships. Right. Some successes, more visibility, stronger collaboration with community partners, and challenges around grant limitations. Yep. So I'm wondering for the folks that say that like program directives and outcomes are rigid and challenges around funding and grant limitations, is that, and you all can answer this in the chat if you'd like, financial challenges with grants. I mean, is that because I'm wondering where that's coming from? Is that coming from um, grant requirements being very strict in terms of the kinds of data they're expecting you to report? Like, I know that a lot of grants are very numbers focused, right? Like they want to know how many people you've served and how many people, came through the doors, things like. Is it because they're looking at those kinds of requirements and not focusing as much on kind of the more qualitative, more um, stories about the impact of the work, or is it something else? And feel free to drop something in the chat or unmute.
It's easier for me to just talk.
Sure.
And so in the hospital-based violence intervention space, the programming is intervention-based. So there's a lot of red tape around like prevention work, which is really where the focus should be to try to
Right.
prevent, violence before it actually takes place.
Right.
So unfortunately, in the hospital, there's a lot of families that, are identified in clinics in different areas where the kids are high risk for being involved in violence or becoming a victim of violence, but we're not able to work with them until after they've been hurt or injured. And so that makes it difficult when you kind of see the risk factors and the other social determinants that lead to, kids coming back through the trauma bay, with a penetrating gunshot wound. So just it makes it significantly challenging to be able to really kind of work the program when, the focus here is intervention and not necessarily prevention.
Right. Thank you
Yeah.
for sharing that, Cameron.
Yeah.
And Rhonda in the chat shared also for us the challenge with grants is as you said, they're looking at numbers instead of narratives to support maybe low numbers but high impact in the community. So connected, similar and connected there as well. Thank you for sharing that.
Yeah. I would add, just occurred, it's like the theory of change that one might have for achieving change. Sometimes those little steps along the way are a lot bigger in practice, a lot more, it take a lot more work and so it's the definition of success and theory of how you get there that I think is very, very challenging to to articulate and to accomplish.
Thanks, Dr. Bethel. We have another comment here. One of the main challenges and every project related to data is about being taken seriously about findings, particularly when using qualitative data.
Mhm.
I think that's, I definitely think that's true. Part of this work, I think, is that we want to try to influence folks and how they read that and how they take that kind of data, right? Like we want folks to be able to share, folks in the community to be able to share those kinds of stories as an equally valid
Mhm.
and accepted form of evidence.
Yeah.
So
Mhm.
yeah, thank you, Zachary. My hope is that by having all three different forms of research, we can have stronger arguments and more impactful narratives for shaping change. That's exactly right. Okay, great. Thank you. I think we can shift back to the slide or no, we've got one more question we were going to put up. So, and folks can just drop this into the chat if they want, but we're coming up with the report for this project, which is going to be probably a 25 page report. And a lot of times we also recognize that having a report like that is great because it'll be full of a lot of really good information, a lot of the stuff we shared here with you all today. But we're wondering if there are any other ways that we could share that information out with folks that would make it helpful to implement those recommendations. Like, should we turn our report into a one pager, have a podcast discussion about it? Do develop kind of like a tool or a worksheet or a checklist or something like that. So just, if you have any thoughts, please share in the chat and let us know. What have you found helpful for different kinds of reports that you've seen, or what would have made it easier for you to utilize it and share it with folks to implement some of those recommendations? Video is also good. Okay, that's great. Yeah, there might be a way for us to take some of what we've shared today and kind of turn it into shorter video snippets. Tools with steps for implementation of each recommendation and examples of frequently encountered challenges and some success stories for each element. That's great. I like a podcast or coaching, hearing from folks who are doing the work. That was a really nice part of the last training with the guest speakers. Great, great. Podcasts are good for engaging folks, presenting in a national conference, being able to see the recommendations for the 5 sectors in a table. They will, we do have a table that's going to be in the report, so that we can at least do, and maybe having that as kind of like a separate pullout that we can share would be really good. Okay, that's great. Great, that's really helpful, folks. Thank you. So I think we can go back to the slides so we can close out with folks and end just a little bit early.
Yeah, as we wrap things up, if anything is still coming to mind, feel free to put it in the chat. But we want to thank you from the bottom of our hearts for joining and engaging with us over the past few months. We've really appreciated your feedback, and we hope that you see your feedback and your thoughts reflected in the report. We really did a lot of iterative changes with the way that we wanted to present some of the things we were finding to make sure that they really aligned with the sorts of challenges and successes you were facing. So we're really excited to share that with you. It's going to be released in early September of this year. So we will send it out to all of you who've registered for our webinars, so you'll have it in your inboxes. But in the meantime, if you have any questions or would like to get access to, the recommendations or things like that before, please let me know. You can email me there, and we're happy to share. We're just want to make it nice and pretty before we share it out to all of you. But thank you so much for joining. As you know, we hope to continue this work moving forward and in different iterations and different ways to connect with you all more as well. So I'll pass it to Ruben to close us out, but thank you so much.
Yeah, thank you. Thanks, Vibhuti. Thank you all for taking the time to share a lot of your insights as well. Those of you all, and I know that there's a handful of you out there who have been part of all three of the webinars we've had on this topic. Thank you so much for seeing us through. Hopefully, you're seeing some of your input and recommendations that you've contributed as part of this process in this report. We're really excited to sharing it, really excited and looking forward to sharing it with you all. And keep in touch about this. We're hoping to then, as a result of this project, integrate some of the things that we've learned from this into a lot of our other work, particularly in the area of violence prevention. So, yeah, thank you all very much for being a part of this conversation with us, and stay in touch. Thank you all.
Thank you.
Thank you.
Thank you all. Have a good day.